The great thing about the Psychological Resources app is that it's a really easy way for staff to access the resources they need in the comfort of their own home. What we know is that doctors just don't access the mental health care that they need. They have lower rates of GP uptake and preventative health care than the general population. They're worried about confidentiality when they're accessing all sorts of care, but particularly mental health care. And there's also a culture about doctors looking after themselves, about them not needing to access mental health care.
Having the extra steps, like trying to find a psychologist or trying to find one that's confidential or one that works with what's honestly a very chaotic schedule, it sort of just disincentivizes you to seek psychological resources.
I think in a moment of crisis, it's really nice that everything's all put together in one very easy to navigate app as well. So I think it's going to be able to help my colleagues to go through, identify what type of resource is going to be most useful to them, and then give them a very easy way to access that resource.
We have our psychological resources lanyards or the QR code where we can find in a lot of different places, including our website. So you just scan the QR code.
Takes me through to Power Apps, and I can either open the app or continue in the browser.
And then you just need your New South Wales Health login to sign on, and once we're signed in, that will take us through to the app. So just opening Power Apps now.
The app just comes up straight away, so really easy, really frictionless.
The app has about 29 mental health resources collated. For each of those resources, we've actually broken down the resources into doctor-specific, district-specific, general community resources, as well as sort of emergency resources.
So to find the Black Dog Institute app, I'd click community base, since that's a community resource. And then I just select on this list here, I would just select Black Dog Institute, and that will give me some information about it as well. So how to access the app, when it's available, how much it costs, etc. And then I'll just click website, and that'll take me through to the resources on the Black Dog Institute we can just work through.
And there's a little bit of information there, and then I can choose Sydney LHD specific, and you can see all the different programs that are available. And I can click on Colleague Care. So Colleague Care is a staff peer support program. You go in there and it tells you a little bit about Colleague Care. It tells you that it's free to access, what to do, and that to access it, you can either find it on the intranet or you can email the SLHD MDOK email, and that will take you through. What I love about having it on the app is that if someone's had something go wrong at work, maybe a patient's passed away unexpectedly or they've made a medication error, they might go home and they might just be thinking about it, ruminating on it, really upset about it. But this way with the app, they could access some help.
It breaks it down into the separate sections in terms of what's available to us locally and what's available on more of a community level as well. And these resources have all been vetted by multiple members of the team as well, so they're all very high quality resources that are included on the app.
People can really be rest assured that if they're accessing this app, no one knows that they're doing that, and they can access the full range of supports that we have available. People don't need to be logged into a work computer. They don't need to wait for a PDF to hit their email inbox. Anyone can access this app at any time, and I think that's hugely important for our staff.
It's just having a tool in our arsenal of well-being that if it does occur, just having the app is just, again, one less barrier to us using it.